Hello, good evening. Hello, everyone. Good evening, everyone, and coming live after a pretty long time because I think this is a need of the hour. Hello, I am fine. Thank you so much. So I am fine and hoping same for you all. And I was getting lot many messages, guys, regarding so many things. So I thought that I'll come live and we'll talk to you. And yeah, Aditya, I got your this thing also request to start the series. It's yeah. So I'm not sure. I'll not doing any promise, but yeah, I'll keep your request in consideration. Let me see. Um, and we will be discussing so many things today. And I have kept this, session, a discussion topic. Ask me anything, and ask me anything. So whatever are your queries related to anything, you can post and we'll be talking about it. Yeah, but I'm not going to teach any topic today per se. Low vision tropic. Debajit, I did not got your question. Mechanism of pterygium. uh See, guys, I'll try to keep academic session maybe tomorrow where I'll be solving your ophthalmology doubts, academic doubts. But today, this is related to strategy. This is related to common things. Mm, Ravi. So NEET 2023. Okay. Right now we are not having any particular date, but I think you should take into consideration, and you should prepare as if it is going to take place in January. That is a safe thing because it's very unlikely that the paper will take place before January. So if you have in January, you are preparing like that only, and if it is going late, then you will you have one more time to revise. So I think that is the best date. uh Ask on the Telegram group. uh, uh, I think weight loss is not a priority for those people who are preparing for the PG entrance this time. And once you get your seat, everything is done. Then obviously you can follow a good diet. You can plan your workout, and you can do the weight loss also, right? Um, Diseases of cornea. How to get time for study if I have a busy schedule? So I think this is a good question indeed. But I would like to know that in which year you are, so that accordingly I'm going to answer. Are you a final year student or a third year student? Because depending upon that, I'm going to give you a strategy. Um all right. Now, those who have started just now, how to prepare. Okay. So, first of all, the thing is, have you already got the notes made? If you have the notes already and you have 6 months, I think not a problem. You can divide this into three parts. First, 3 months, then 2 months, and then 1 month. Okay. First, do your first conceptual study in the first 3 months, so you have enough time. I think the first study, the first revision should not be in a hurry up, because you are preparing it for the first time. Go through the notes. Okay, take the concepts, and if you are feeling that you are not able to study by yourself and you do not have good notes, I think you can join the classes, and they are going to complete in 3 months, and then you can do the further revision in the first 2 months and one more revision in the 1 month. Now if you don't want to join anywhere, and you have notes, then you can do the LMRP also. Okay, LMRP program you can do, and according to those videos also you can revise. I think that is the go through Parsons. Aditya, go through Parsons means what? Is there any new updates in ophthalmology which are not listed in your last year lectures? No major updates in ophthalmology as far as they are concerned up till now, but definitely in my TND, you will get the updates if there are any. So I am not saying that there are any major updates, but yes, be assured if there are any major updates till the time of your TND, they will all be covered in your TNDs. Okay. Low vision topics may particularly which topic? Can you give me any precise topic? There are pharma updates. We have to refer up to date. Uh, Pharma co updates in ophthalmology or in general? Hi, Sunita. So, Sunita, see what is happening. There has been a discussion, though no, clear cut guidelines have been given till now. But the things which are running on in the offices are that there will be NEET 2023, but those people who have already done their internship, obviously they cannot give NEET next. So we are going to have a next in 2023, but those people who have already done their internship, for them, I think NEET will also take place. So for you people, there will be NEET, and for the final years, they will be next. Yeah. Pharma updates on ophthalmology. Yeah, so I am working on the updates till now. There is no major update, but yes, I am going through it, and whatever updates will be there, you are going to get in your TND. Okay, we should believe in official notification. Exactly, that is what I am saying. That see, all these things are going on, but till the time you get any official notification, don't fall into any trap, don't listen to any rumors. Keep on preparing daily. I think that is the most important thing. Keep on preparing daily as if your paper is in January. That is the best thing you can do right now. Best thing. Be positive. Don't search for any such news on different groups and different portals of the social media. I think the best thing you can do is keep on following your strategy, keep on following your plans, and keep on studying. Please come live after every weekend. Yes. Yeah, so I'll try to come live more often. Actually, it's little busy going on. And what is the hydrophobic lens? Hydrophobic lens are actually the ultra thin lenses which are used for the modern techniques of the cataract surgery. These are the ultra thin lenses. Okay. Hi, Varisht. 90D lens, 60D lens, 78D lens. These are the different lenses that we are using to watch the posterior segment. See, you know that by the anterior segment, you can see only up to the lens. Okay. So if you want to see behind, we have different kind of lenses available. 90D lens we are using over the slit lamp to see the fundus. So mechanism, for doing the ophthalmology, you do not really require to know the mechanism. That will go on the PG level, but you should know what is the use of these lenses. Hi, Varisht. So, okay. So, based on your queries, I'll try to record a small video also on these lenses. Like we have Ruby lens, Goldman lens, we have got 90 lens, 60D lens. Like we have 20D lens that is used for the indirect ophthalmoscope. So, I'll try to record one short video and I'll give you. Yeah, gonioscopy also. So all the, different instruments that we are using, different kind of lenses, gonio lens also, I'll try to record it. Right. Yeah. Mechanism of pterygium. Rahul has asked me mechanism of pterygium. What means mechanism of formation or mechanism how it is causing the diminution of vision? Be more specific, Rahul. Um, the difference between the nerve fiber layer and the neuroretinal rim, there is no difference. The neuroretinal rim is made up of the nerve fiber layer only. So when I'm talking about the nerve fiber layer thickness, I'm talking about the neuroretinal rim only. All right. And uh, and guys, if you have time, really please go through the Parson series also. See, I do not actually, pressurize anyone to go through the Parson series because you may not have the time. But indeed, if you have time and you are doing your third years, I think that's a boon. And that has taken so many hours for recording actually. And I think we could not have done it because it takes a lot of time. That was a blessing in disguise of the COVID that I utilized the time for giving the Parson series. Uh, Now if I want, I could not have recorded so many lectures line by line Parsons, but fortunately we have done this in that COVID time. So I think if you have time and you can afford it, please go through the Parsons series. That is very, very good. uh all right. uh 1.5 syndrome. Hi, Vidhi. Yeah. 1.5 syndrome, Vidhi. I have given a full video on my channel, and by the name of gaze palsy, also it is there. And one more video, 1.5 syndrome in 1.5 minute. So please go through these videos, and if you have any doubt, please, you can always message me. Uh, why rod spots in infective endocarditis? Because we have got hypoxia and ischemia there, which is causing the retinal hypoxia. And it is the retinal hypoxia which is actually causing these small hemorrhages. So these are the small hemorrhages by the name of rod spots that you are getting in infective endocarditis. There is, yeah. Thank you, thank you. I do not know what to reply on this. Uh, For which dry condition we use CMC, sodium hyaluronate? Which dry eye conditions नहीं है? Depending upon the severity of the dry eye, we actually choose this. So I do not know whether you are asking is as a personal case or you are asking is academically. You will not go get any such question that in which dry condition you will give this. And when you are doing the PG in ophthalmology, then by experience you will learn this, that which of the drops is used in how much of the dry conditions. Okay. Aditya, quizzes are going on from 1st of July daily in evening 10 p.m. And I am giving the topic in the morning and the quiz is taking place in the evening 10 p.m. So yes, those of you who are new to this channel, we are already starting with the quiz, and quiz on my Telegram group is going on daily at 10 p.m. sharp. 10 questions, 1 minute per question. And I'm giving you the topic in the morning itself. So I think that is the best way of revising ophthalmology, because I was getting a lot of requests. This is a volatile subject, how to remain in touch with the ophthalmology, how to recall ophthalmology. So I think that is the best way, just a very small topic. And even if you are revising and you are learning any other subject, then just a small topic from ophthalmology, you can keep on preparing daily and you can attempt the quiz, right? Hi, Dr. 13. That's very good that you are really passionate. I think that really becomes tough sometimes to balance your professional life, your personal life, students' life, and you remain divided. But however, those people are passionate like me about the students, about the teaching, they actually tend to manage, and I think you will also. Uh, what is neonaturum? Neonaturum means when it is taking place in a neonate. And what is a neonate? Neonate means less than 1 month or 28 days. So when we have ophthalmia neonaturum, it is the conjunctivitis which is taking place in a child less than 28 days. That is ophthalmia neonaturum. Uh, Formation of pterygium. Formation of pterygium, actually it is a both degenerative as well as a hyperplastic condition which is taking place, and there is a growth of conjunctiva which is taking place over the cornea. Okay. um how to prevent RD if the patient is in PVD stage currently? uh See, PVD is actually the posterior vitreous detachment. Posterior hyaloid membrane is very very loosely attached to the retina, and that is why PVD is not pathological, it is a physiological condition. With aging there can be a vitreous detachment and we can have this PVD. Yes, remotely this PVD can lead to RD, but not definitely. So you don't have to do anything in the PVD actually to prevent the RD, right? PVD is not self-resolving, but it is not causing any problem also. So it can keep on like this. Okay, what are the differences between lotion, cream, ointment? Ravi, are you doing ophthalmology residency? Because your question seems to be like this. Uh, yeah. Herpes zoster and herpes simplex. See, as I always say, simplex is simple one. So it's a simple, less severe, and less severe things are always more common, while more severe things are less common. So herpes simplex is a milder one, not causing much systemic features. It is just causing the ocular features, and the characteristic feature in the eye is the dendritic keratitis. This was asked this year also. I love all my students, and I don't think I have to comment something special for one person. Okay, so please post the academic doubts. So yeah, so herpes simplex is causing a typical type of keratitis that is called as the dendritic keratitis, where we have tree-like arborizing pattern. While on the other end, herpes zoster is the most severe one, where you have got the systemic features also, and you have got the strict distribution on the one side of the forehead. You have all the three divisions of this ophthalmic division of trigeminal nerve involved. We have a frontal, lacrimal, and the nasociliary. Now what is happening? Frontal division, so we have got the frontal eruptions here, then we have got the eye involvement that is there, and then we have got the nasociliary involvement. Now because they are taking place in this order, so what is happening, that if I have the eruptions on the tip of the nose or the side of the nose, then there are more chances of the ocular involvement, and that is the reason if I have the eruptions there, then we at once we start with the lacrimal treatment that is there. And if you look at the characteristic feature here, you get the pseudodendritic keratitis, plus you also get the nummular keratitis. So here you have the typical dendritic keratitis, or here we have got the nummular keratitis, or the pseudodendritic keratitis. Okay. mm, how many minimum experience years it takes to start a full-time clinic? uh Full-time clinic, see, it is said that earlier you start your PP. If you want to start the PP, better it is. And Baki, it depends upon one personal, an individual choice also, your confidence. If you are feeling that you are not still ready, then you can go for the SR ship. You can go for AP ship in any good college, and then also you can start. Okay. I am good. I am fine. I hope you people are also fine. Please clarify when steroids are contraindicated in keratitis. See, in many types of keratitis, steroids are contraindicated. Like if I talk about the dendritic keratitis, maybe steroids are actually contraindicated. And then we have the fungal keratitis may steroids are strictly contraindicated. So basically it depends upon the type of keratitis where that steroids are contraindicated or not. uh, Elastotic degeneration is mainly involved in the pingicula, guys, not the pterygium. uh, Yeah, Endophthalmitis is the inflammation of the inner layers of the eyeball, and it is sparing the sclera. The outermost layer, that is the sclera, is not involved. Whenever the inner layers of the eyeball are involved, that is your endophthalmitis. Macular star never causes papilledema, and it forms due to hard exudates. No, no, no. Uh, Macular star is found actually in cases of the raised intracranial tension. So, raised intracranial tension can lead to the papilledema, and that can also lead to macular star. Macular star is also found in one kind of optic neuritis, that is neuroretinitis due to the macular exudates. Okay, Aditya? Hi, Mask. Oh, I'm very happy that you could reach to your dream branch, PG Ophthalmology, and I could actually clear your doubts. And we are trying to arrange some classes for the PG students. I hope I'll be informing you about this very soon. Mm, how to remember all the terms in ophthalmology? I love the subject, understand all the concepts, but tend to forget the terms. Uh, I think the key of remembering the terms is that you have to keep on revising, and that is why I'm saying please keep on giving the quizzes or very, very small topics. If you keep on revising them, I think recall will become easy. Plus, you can use the mnemonics. Like in my notes, I have tried to give many mnemonics so that you can easily remember the important terms. So I think practice again and again, revision again and again is the trick. Uh, Elastotic degeneration. I am a student of B. B means elastotic degeneration is a type of degeneration. I think type of degenerations you people learn in pathology. Uh, Ciliary tenders. Manoj, I could not get your question, and this, fly is irritating me. Yeah. So, what is these ciliary tenders? I could not get your question. Kingsman, please allow the other people who are trying to learn, who are trying to actually focus, let them focus, okay? Um, yeah. This December, will it be the last time we will be giving MCI? Maybe. I'm not going to comment anything on this right now because they have not given you any clear cut notification. So let some time more pass more, and then we will be giving you clear cut thing. I have seen a lot of your videos and those are very effective. Thank you so much. Should I go with love marriage or arranged marriage? Ajit, I think we can talk about this on the direct message. You can discuss your this is a, I think, your personal matter, and I don't want to talk to you about this on this open platform. We can discuss about this on the personal chat. Okay. Uh, what about occupational optometry? uh occupational I think you are talking about the career prospects of optometry. Please be more specific. Hypopion, Manoj. Hypo means down, pion means pus. So hypopion is the pus in the anterior chamber. We can get them cases of the uveitis. How do we best acquire a clinical acumen like you do have? Sometimes reading alone, like you do have. Sometimes reading alone seems not to yield the same benefits we get from watching videos. Uh, Truth is, thank you so much, Dr. Eddy. I think clinical acumen always comes with a lot of knowledge and a lot of practice as well as with time. So that is my very small effort with the help of clinical scenarios to actually teach you that clinical acumen, how you actually should read the question, how every word of the question should strike your mind, and what are the things that should come to your mind while doing those questions. So I think if you do more of study and revise more and more clinical scenarios, do more practice, you will definitely get the clinical acumen. um, Different What is difference between hypertropia and I think Mani Ratnam, you want to say hypertropia and hypotropia. There is some printing mistake. Have you come up? Thank you. Finally, you talked up something about the academics. We have our module exam on ophthalmology on 18th. I've been watching your videos and I get full marks. Oh, thank you so much. And I'm very happy that you are confident. I think, confidence is one thing which actually speaks louder in your exam. And even if you are getting wrong somewhere, that confidence will help you and bring more positivity in your paper. So I am very happy that you are confident after seeing my videos. And all the best for your exam. Uh, is Oftal a good as a career option? Definitely, obviously, like, I think I'm a living example of ophthalmology as a career. And I think ophthalmology is a career where you can have a balance between the two things. And ophthalmology is a career where you have a balance between the medical as well as the surgical field also. So both ways it's a good career. And I wish all the best for you. How to identify hyperphoria and hypophoria by the Madox rod test? Yeah, Madox rod pe Dharminder, I have given you video on my YouTube channel. You will get a video on the Madox rod. Please go through that and then let me know if you have any doubts. Full playlist of your videos on peds of Tel and strabismus. Mm, Hi, Dr. AD. No, I do not have the playlist on the peds of Tel as such, but yes, Squint is there. So if you go to my YouTube channel, you will get videos on Squint. So you can search on it. And I think I had explained on a 3D model also, and you can take the advantage of that. I am finishing the ophthalmology before this 20th. So just one request, if you can come up with the latest question and discussion session for December 2022. I think you are talking about FMGE examination, Cricket Library. And definitely, I'll be bringing more and more series of revision for NEET, for next, for FMG. This is just a warm up session today. I just came up to say hello and hi to all of you. And Dr. Adia, I think you can join my Telegram group, and there I have shared the full playlist of so many videos. Today, again, I'll share that. You can join my Telegram group. I'm sharing the link also, and there you are going to get. So, I'm sharing the link of my Telegram group. You can join this, and you will get all the playlist here. Secured first rank most of the quizzes after attending your classes and professional admired for your for acumen. Oh wow, Aditya! I think this is really wonderful. I think the most you know awaited gift for me is that when my students say that they are getting good marks, distinction, or they are getting admirations from their professors. I'm the first person to be happy for that. Very good. Uh, Mom is experiencing floaters and photopsia, no specific treatment. S, you can directly message me for your these conditions. Okay. Toxoplasmosis is a granulomatous panuveitis, guys. So I think for today we have done all the queries, and I can come tomorrow also if I get time. I have to see once. So please be ready with more of your questions and more of your doubts. And I think tomorrow, same time, again, I'll come live, and we will be having more of discussion, more of planning for strategies. We will also have a discussion that uh, this that how what type of revision sessions we should plan further on the YouTube channel. Right, right. So what you can do, guys, that you can revise your ophthalmology and come up with the academic doubts also tomorrow. So today we have talked about the strategies and all, and tomorrow we can be talking about the academic doubts. So take care, guys. Take care, guys, and happy ophthalmology. See you tomorrow. Bye bye.